So today we're going to speak about the squamous portion of the temporal bone. As you can see here, this is it, and it's going to extend anteriorly where it would meet the sphenoid bone and form the spheno-squamosal suture. Superiorly, it's going to meet the parietal bones, and that forms the squamosal suture, and then inferiorly, it meets the condyle of the mandible where it articulates to form the temporomandibular joint on either side. It's the largest of all the 5 parts which form the temporal bone, and it's very thin structure. So squama in Latin means scale, so squamous means that it sort of represents a scale, like a fish scale. So as you can see here, this is the external acoustic meatus, which is going to lead from the external ear towards the middle ear. The roof of the external acoustic meatus is formed by the squamous part of the temporal bone, although the rest of it is formed here by the tympanic portion, which will be discussed later. But so the roof only of the external acoustic meatus is formed by the squamous portion of temporal bone. The outer surface is slightly convex, as you could see, meaning the inner surface is obviously concave, and it's really smooth, unlike the inner surface that you could see here. So it forms part of the temporal fossa for the attachment of the temporalis muscle. The temporal line can also sometimes be seen running along the posterior aspect of this portion, but you can't really see it here. That's probably because it mostly traverses the parietal bone, which provides the attachment for temporal fascia and limits the origin of the temporalis muscle as well. So it's crossed by the branches of the superficial temporal artery, which you should be able to see around here. And this gives branches, so it's going to provide a parietal, a frontal and a middle branch, which is going to course over the surface of the temporal squamous bone. You can also see a really long process extending out from it, so this is the zygomatic process. This will meet with the temporal process of the zygomatic bone, and collectively it forms the zygomatic arch. At the point where the temporal and zygomatic bones meet, you'll get the zygomatico-temporal suture. At its very origin, you'll be able to see that the process is sticking out the way, so it's coming laterally, so that its anterior and posterior aspects are facing superiorly and inferiorly. So here, you'll see that this is superior, this is inferior, but along its length, the zygomatic process twists on itself so that its superior aspect will then become medial and its inferior aspect will then become lateral. So this gives it a superior and an inferior border and a medial and a lateral surface. The superior surface is thin and sharp, you can kind of see it here, and this provides an attachment for the temporal fascia. Its inferior surface is shorter than the superior border, and it's a bit thicker as well, and it provides an attachment point for some of the fibres from the masseter muscle. Its medial surface here is concave, you can see it curving in the way, and it also provides an attachment for masseter. And then its lateral surface here is convex and subcutaneous, so it's just sitting underneath the skin. The process also divides the temporal fossa and infratemporal fossa, so anywhere above here is temporal fossa and below is infratemporal fossa. Infratemporal fossa provides a pathway for neurovascular structures, and it contains some of the muscles of mastication, so that would be things like masseter, medial pterygoids, lateral pterygoids. The internal surface of the squamous portion here you can see looks very different. So it's got these convolutions which are created by the gyri and sulci of the temporal lobe, which will be found just within this portion. You can also see quite an obvious groove here running along the superior aspect of it, and that is caused by the posterior division of the middle meningeal artery. So this artery crosses between the temporal bone here and the dura mater, which is the outermost layer of the 3 meningeal layers covering the brain, and it supplies blood to all 3 meninges around the lower parietal region. So as I said, this would be the parietal bone here, so it's going to provide an arterial supply to this region here. So more about the mandibular fossa. This mandibular fossa here, this is it here, it's going to be divided into two portions by this. This is the petrotympanic fissure. So it divides the mandibular fossa into an anterior mandibular fossa and a posterior mandibular fossa. So only the anterior portion of the mandibular fossa is created by the squamous portion of the temporal bone. The posterior mandibular fossa is formed by the tympanic portion of the temporal bone. So the differences between these two portions, this one is much smoother, as you might be able to see. That's because this is the articular surface for the temporal mandibular joint. So this is where the condyle of the mandible will articulate, and it's going to be covered in cartilage to allow movements, gliding movements. The posterior mandibular fossa doesn't actually contribute to any articulation of the joint. It's thought to be important to prevent backward displacement of the mandible, but that's most likely better said for other mammals other than humans. After dividing the mandibular fossa as well, the petrotympanic fissure will actually lead into the middle ear, and it will lodge part of malleolus, which is one of the ossicles of the middle ear, and it also transmits the tympanic branch of the maxillary artery. So just to go over the temporal mandibular joint once more, this here is the condyle of the mandible. This here would be the anterior mandibular fossa, and there's also an articular tubercle of the temporal bone, which you can see just under the zygomatic process. So this is it here. So these structures contribute to the temporal mandibular joints.